Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit NPTEFF.com to enroll today so you can pass tomorrow.
Thank you for joining us here on the NPTE Final Frontier podcast. My name is Emily, and today I will be diving into the differences between a Colles fracture and a Smith's fracture. Both of these types of injuries involve fracture of the distal radius. However, the main difference is the direction of displacement. So first, let's discuss a Colles fracture. A Colles fracture is defined as a complete fracture of the distal radius with posterior displacement of the distal fragment. This fracture is often characterized as a dinner fork deformity due to its presentation on imaging. The mechanism of injury is most commonly due to a fouche, which stands for a fall on an outstretched hand. It is important to be mindful of the potential complications which can be associated with the Colles fracture. These complications may include compartment syndrome, median nerve injury, carpal tunnel syndrome, vascular injury, osteoarthritis, malunion, tendon injuries, or chronic pain. So now that we have reviewed a Colles fracture, it's time to review a Smith's fracture. This type of fracture is the reverse of a Colles fracture. So what do I mean by this? I mean that this is still a complete fracture of the distal radius, but now there will be anterior displacement of the distal fragment. This type of fracture is characterized by a garden spade deformity due to its presentation on imaging. Now, the mechanism of injury for a Smith's fracture is commonly due to the fall on the back of a flexed hand. It is just as important to be mindful of the potential complications which can be associated with the Smith's fracture as well. However, these include malunion, carpal tunnel syndrome, and complex regional pain syndrome. So during examination of both a Colles fracture and a Smith's fracture, the patient can present with pain, swelling, limited range of motion, and tenderness over the distal radius. X-rays are the most commonly utilized diagnostic tool which help to rule in this type of fracture, especially when viewing from the lateral view or the posterior to anterior, which is also called the PA view. So treatment for a Colles fracture or a Smith's fracture can include a closed reduction followed by immobilization in a splint or cast, or an open reduction with internal or external fixation, which would also be followed by immobilization in a cast or splint. There's also edema reduction, pain management, and emphasis on early mobilization and joint mobility with muscle strengthening. So just to remind you all one last time, the main difference between a Colles fracture and a Smith's fracture is that a Colles fracture will be a posterior displacement and a Smith's fracture will be an anterior displacement of the distal fragment, both due to a complete fracture of the distal radius. Thank you very much for listening. For more information on the NPTE Final Frontier, please visit NPTEFF.com. You can also check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok. I hope you found this episode discussing the differences between a Colles fracture and a Smith's fracture helpful. So here's a quote from Helen Keller. "We can do anything we want to if we stick to it long enough. So that's right, warriors. Keep on pushing. You can do this." Till next time, have a great day and a powerful tomorrow.